Let's talk to Niall Dickson. He's Chief Executive of the NHS Confederation. Good morning to you.
Good morning.
Now, we know no contact trace system is absolutely perfect. We know even the ones that we've been raving about in places like South Korea, they're still not perfect as well. Not everyone's going to have the apps. We haven't even got that yet. Not everyone's going to be traced. But it absolutely defies belief to me that someone can get a hold of a test and have to provide. You don't just do a test randomly. You have to provide your name and your details to do that test. How is it possible that the contact trace people are able to then trace the people who are having the test and getting a positive test and then tracing their contacts? What's going wrong?
Well, I think it's quite hard to say, to be honest. I think the first thing is that people who have had a test, you should be able to contact them at some point. And, they're trying to phone these people kind of 10 times a day. And obviously some of them they're still not managing to get through to. So I think there's definitely that figure ought to be able to increase it, and you just keep on attempting to contact them.
Well, apparently there is a problem with the number that comes up on people's phones is either an unknown number or an 0300 number. And then there's no ability to call people back. These contact tracers don't give, for instance, their mobile number so someone can get back to them. So if you do miss the call or you don't answer the call, you've got no way of getting back, which seems to me, just really basic stuff here.
It does, and I think the answer is they've got to continue to learn lessons, because you're absolutely right. There are only two ways in which we're going to see the peak reappear. One is if we don't socially distance, so obviously that makes some of the stories and pictures in the last 2 days a bit of a worry. And the second is this contact tracing process and getting it up to, as you say, you'll never get it to 100%, but the figures they're really not good enough at the moment. We're getting hold of 70%, who are providing contact, and then of those we contact, and then 82% of those contacts we're reaching. And obviously the contacts are more of a problem. It's slightly more distant and so forth. But the reality also is that even those who are testing are not the only people who've got the virus. Yeah. We know that the virus is sitting in the community, and it's relatively small, but as you say, that's starting to level off. So you absolutely have to keep an eagle eye on this.
Yeah, we know it's in the community, but it is very, very low. And the reality is most people in this country won't know anyone who's had the virus, and it is unlikely to catch the virus in the current circumstances, which is why perhaps people are being a bit sort of too carefree right now. But if we're only catching, we understand that only a third of the people who've got the virus, it's estimated, are actually being diagnosed and having a confirmed case. And we know that huge numbers of people may have the virus and have no symptoms whatsoever, and therefore not be traced. But if you're only getting, a third of the people are even getting a test, and then only 70% of that third are actually being tracked down afterwards, and then only 82% of their contacts, given the time frame and all of that, those people have already infected 100 people.
It's not enough as it currently is. And if you look at a photograph of a beach which has got 3,000 people on it, that means it's 1 in 1,100 individuals in the community in England are estimated to have it. That was in June, the 8th to the 21st of June. So that means there are 3 people wandering around that beach who are having contact with other people who are likely to be spreading it. So, no, of course, it isn't big numbers, but those individuals, of course, if they were at home or they only met their friends, then, it's possible that they would and they observe some form of social distancing, which we should all do, they wouldn't be actually spreading it to possibly to one other or less than one other. If they wander around a beach and they're spending a lot of time with individuals, they're more likely to spend it to more. And that's why that side of it is so important.
Except, of course, going to the beach isn't illegal. Having a legal party or going to a mass protest is illegal. We've had a lot of that in London lately. But going to the beach isn't illegal. Some of those photographs, when you look at the side photographs of places like, say, Bournemouth, it looks absolutely appalling. It looks like people are literally sitting on top of each other. When you see some of the aerial photographs, though, people do look to me as if they are at least 2 metres apart. People are on the beach, they're with their family units. Yeah, they're in groups, but people go as family units, as which, a lot of people who seem to be complaining about this, I think, are people who live alone and don't have any friends. But, these are, okay, lots of people have, 3, 4 kids. So it's probably not as bad.
Right.
It's not as bad as it looks, I think, some of that.
No, you're absolutely right. The side photo point is very well made. But again, dare I say it comes down to common sense.
Yeah.
And of course, there's a danger now. We're giving more nuanced messages. We are saying to people, you have to make a personal sacrifice if somebody contacts you and say you've had contact with somebody who's had the virus, you now have to go away for 14 days and lock. So I think it all becomes slightly more difficult. And I think the other problem is, and you can see this, I guess, just in people's frustration, they feel that they've been locked away and so on, and there's a real desire to kind of get out there and so on, and that's absolutely understandable. But it's about, when you do that, exercise common sense in terms of your dealings with other people who you don't know where they've been, as it were, and continue to wash your hands.
I mean, now the NHS Confederation, just finally briefly, if you were to, you're representing NHS trusts, all the doctors and others, all those who are trying to keep people safe, keep people alive. Is there a feeling within the NHS, within people looking at this footage, looking at whether it's Black Lives Matter protest, street parties, or people at the beach, that you're all sitting there going, right, we're going to be very busy in the next few weeks?
I think that's a real fear within the service at the moment. I think people have made, and there's some really exhausted staff of those who've been through the mill on this, and I think there is genuine concern that they could face another wave, and there's also real anxiety about people's expectations. The reality is parts of the health service will only be able to operate at 40-50% productivity for a considerable time to come, and there's a fear that people just expect too much.
Okay, thank you very much indeed, Niall Dickson, Chief Executive of the NHS Confederation.